My name is Lawrence Medina. I'm the Executive Director for Rio Grande Alcoholism Treatment Program, serving Taos County, San Miguel County, and Colfax County. Rio Grande, also known as ATP, has been providing substance use disorder since 1978, and it started out of Rio Arriba County and Embudo. Based on stigma and how we're addressing it, or the need to address it, is understanding that we do have a problem and that addiction is a disease and not a moral issue. We've been faced with, for an example, I'll give you a stigma example of trying to reopen our detox center in Taos County, and we had local officials blocking that because of their belief system, or that they basically did not want a detox center in the city limits of Taos. And it was very disheartening, very challenging, because at the same time we're seeing Taos County residents falling through the cracks, needing these vital services. And so when you look at stigma and you look at the institutional and social inequities that we're faced with, is that we need to address that, and we need to address it with our elected officials and stakeholders to educate them on these vital service needed, and not make it political, not making it one's opinion is that addiction is known as a disease and needs to be treated accordingly. We find through the data that shows in Taos County that it's costly, that all the folks going to the detention center and housing them there and putting a cost. We also look at the cost of individuals going into the hospital, the emergency room, for overdoses, chronic liver disease, and so forth. And that's very costly to the taxpayer. And when you look at this public health and public safety issue, we, as the stigma campaign, meaning that we need to raise awareness to our elected officials and stakeholders on how, as a community, we could address this. Even the folks that are anti-supportive of this, but we could come to some sort of compromise in seeking better solutions rather than trying to do the same thing over and over, expecting different results. Based on the demographics of Taos County and the diversity that we have, we need our elected officials to better represent the demographics, meaning that, we have majority of people of color, we have a large population, people living in poverty. Over 50% of Taos residents are in some sort of public assistance. And I really believe that we need to better represent these populations, not only to get them help with substance use disorder and mental health, but let's get them jobs, and let's make them productive citizens in efforts to contribute to our economy. And as we say in El Norte, the dicho, the saying, una vida buena y sana, that we all could promote a good and healthful life.